All right, good afternoon, everyone. We are pleased to welcome back a national and global audience. All right, so welcome into the space. Those of you who are regular to our events and also those of you who are participating today for the first time, welcome and thank you for joining us this afternoon. All right, my name is Tiffany Rasmussen. I'm with the Columbia School of Social Work, Office of Professional Excellence. We're excited to have you for today's panel, the 2020 Post-Elections Debrief, Understanding the Broad Implications. This is the second of a three-part series organized by OPE, the Columbia School of Social Work Office of Diversity, Equity, Inclusion, and the Social Work Action Lab for Social Justice. We held, session one was held on November 10th, and it provided a space to process the initial election results. And today's session is going to focus further on understanding the political climate and possible policy implications we'll see coming up. The third and final session to be held in January will discuss ways we can move forward through increased engagement and hopeful action. So we invite everybody to respectfully participate in the chat and the Q&A boxes. We are reserving time at the end to select additional questions that you may have for the panel. Please put those in the Q&A box, separate of the chat box. So any questions that you're hoping that we can get to with the panel, put those in the Q&A box so we can keep track of them for the moderator. We're going to work to get through as many as possible as time allows, with priority being given to the ones that fall in scope, fall within the scope of today's objectives that were described on the events registration page. Separately, throughout the discussion, you're welcome to respectfully share your thoughts, reflections, any resources you may have with other attendees in the chat box. We actually both encourage and welcome this as a way to just further connect with one another in this virtual space and foster community. When typing in the chat box, you do have the option to select panelists and attendees if you want for your comments to be seen by the larger audience. If you haven't had a chance to do so, we actually invite you to go ahead, find the chat box, introduce yourselves. We'd love to know who's in the space with us today and where you're joining us from. So it's now my pleasure to introduce Dean Melissa BEGG. Dean BEGG became the 18th Dean of the Columbia School of Social Work on September 1st, 2019. Her work, Dean BEGG is an accomplished scholar, committed educator, and creative administrative leader. Her work has focused on convening interdisciplinary teams, developing innovative curricula, creating mentorship programs, and enhancing diversity in education and the graduate education and the research workforce. She's deeply committed to the School of Social Work's social justice mission and the pursuit of better science for a better society. With that, it's my pleasure to turn over the camera and mic to Dean Melissa BEGG.
Thanks so much, Tiffany, and thanks to everyone for joining us for today's post-election panel discussion. As Tiffany noted, this is the second in a three-part series that is examining the broad implications of the 2020 election with a special focus on racial equity, the economy, healthcare, criminal justice, and social unrest. As we get started, I'd like to share just a few words about the Columbia School of Social Work. Our school places social justice and racial justice at the center of all we do. The school's faculty, students, and staff work to promote well-being across all sectors and strata of society to ensure that all can reach their full potential. Social workers know from long experience that the main obstacles to well-being are structural and systemic. They are enacted through policy. Social workers witness the consequences of problematic policies every day. They understand that policies must change, and they see that the route to better policy is through better government. Hence, social work's laser-like focus on voting rights and voter engagement. Now, we have just experienced what may well be the most consequential election of our lifetimes. And while we have cause for hope as the rollout of the COVID vaccine begins, our country will still be grappling with the ongoing epidemics of COVID and anti-Black racism and the extreme economic and social damage being inflicted on the most vulnerable among us. Clearly, this conversation could not come at a better time. So at this point, it's my pleasure and honor to introduce our esteemed moderator and panelists. Moderating today's session is Karma Lowe, Columbia Social Work's inaugural Associate Dean for Diversity, Equity and Inclusion, and Community Engagement. Dean Lowe heads the Office of Diversity, Equity and Inclusion, which was formally established just about 2 years ago. During Karma's tenure in various student-facing roles at the school, she has been a beloved advisor to student advocates who shared a passion for expanding diversity and inclusion practices across the school. And under Dean Lowe's leadership, the office provides a wide range of programming and community building efforts, especially for students experiencing marginalization. Next, it's a pleasure to introduce Ronald Mincy. He is the Maurice V. Russell Professor of Social Policy and Social Work Practice and Director of the Center for Research on Fathers, Children, and Family Wellbeing. He is a co-principal investigator of the Fragile Families and Child Wellbeing Study and is also a faculty member of the Columbia Population Research Center. His research rests on the premise that for the United States to truly reduce poverty and provide equal opportunity for all, policymakers must address the problems faced by young Black men who continue to have the poorest life chances of anyone in our society. Dr. Mincy is the author of numerous articles and books and has served on many national committees and boards, including the National Poverty Center at the University of Michigan, the Economic Mobility Project of the Pew Charitable Trusts, and the Council of the National Institute of Child Health and Human Development. Next, it's my honor to introduce Jamie Daw. She's an assistant professor of health policy and management at the Mailman School of Public Health, and she too is a faculty member of the Columbia Population Research Center. Her research seeks to inform the development, implementation, and evaluation of health policy. She studies how policies affect access to health services among reproductive aged and pregnant women, how changes to Medicaid policy and new healthcare delivery models can promote improved healthcare access, quality, and health outcomes over the extended postpartum period. And she also studies prescription drug coverage policies and access to medicines in the United States, in Canada, and in other high-income countries. Dr. Daw's work has been published in leading journals, including the Journal of the American Medical Association, the Canadian Medical Association Journal, and Health Affairs. Next, it is my great pleasure to introduce Gregory Warrow, who is professor and chair of the Department of Political Science at Columbia University. Dr. Warrow specializes in American politics, including Congress, elections, campaign finance, judicial politics, and political economy, as well as political methodology. He is the author of the book, Legislative Entrepreneurship in the U.S. House of Representatives, and co-author of Filibuster, Obstruction and Lawmaking in the United States Senate, which won the 2007 Richard F. Fenno Jr. Prize as the best book in legislative studies. He has published in numerous journals, including the American Journal of Political Science, the Annual Review of Political Science, and Political Analysis. In addition, Dr. Warrow has been a visiting scholar at the Center for Basic Research in the Social Sciences at Harvard. Thanks so much to all of you for joining us. I'm so looking forward to this discussion. So Dean Lowe, it's my pleasure to turn it over to you.
Thank you, Dean BEGG. I just want to echo Dean BEGG and Tiffany Rasmussen's sentiments in welcoming everyone, especially our panelists. And I also want to thank you all for being here today to share your knowledge and perspectives from your various fields of expertise. So we've collected some questions from our participants during the registration process, and I'm going to be using that to sort of guide our discussion today, which I see as just a conversation between peers. So please feel free to respond to each other, pose your own questions, etc. For our audience, we're going to talk for about an hour, and then we'll take some questions from the audience via the Q&A chat box. As Tiffany said, we welcome you to use the chat box to comment, to share resources, to cheer people on. And then for our Q&A session, which will be about the last half hour of today's event, we'll take them from the specific Q&A box. And let me apologize in advance to our audience, as I have a feeling that we won't be able to get to every question posed, but we will do our best to answer as many as possible. So here we are. It's been 6 weeks since Election Day. We're just several days away from the Electoral College affirming Joe Biden's win of the 2020 presidential election. And while we have a hopeful and celebration-worthy news of the first doses of the coronavirus vaccine being administered, there's still a lot that's in limbo post-election. We're awaiting a stimulus package, economic relief in general for Americans. There are still people who are peddling misinformation regarding the election outcome. And now our country and our legislative leaders seem quite divided. And we are with what I would characterize as sort of a final fight for control of the Senate, waiting on the Georgia Senate races, and determining whether or not the Biden-Harris administration will be wrestling with our current Senate Majority Leader to push through their legislative initiatives, or will we see a Democratic-led Congress? So tensions are clearly high, and I'm wondering if each of you can offer a perspective on the current political climate as you see it, and what we may expect to see in the coming months as part of the transition through the next couple of years as we near another round of congressional elections. So I'm going to ask Dr. Warrow to speak first.
Thank you. I just wanted to clarify, are you sure it's been 6 weeks? It feels like it's been 6 months since the election, but I'll check my calendar. One way that I think it's appropriate to think about this election is that it was like 2016 in the sense that it was largely a coin flip election at the presidential level, given the very narrow vote margins in critical swing states. And it just turns out that in 2020, the coin ended up coming up D instead of R. And I think that in terms of like what has changed, a tremendous amount has changed since 2016, but yet in terms of the electoral landscape, not much has changed in terms of how the country is divided in its support for Republicans and Democrats at the presidential level. If we look down below the presidential level at the House and Senate level, 2020 was basically a wave election in favor of Republicans. I think a lot of individuals were anticipating a wave that would be in favor of Democrats, given concerns about the pandemic response, the major downturn in the economy, worst downturn since the Great Depression, and various other policies that Donald Trump had pursued that and other various things that he had done in terms of trashing norms that presidents have long adhered to. I think that the polls prior to the election at the congressional level were very far off, and it led to the perception that there might be a rebuke of the Republican Party for siding with Donald Trump. Donald Trump is not a traditional Republican. He's departed from Republican Party orthodoxy in many, many ways. But the party has largely thrown in with him. After he won the presidency, many individuals who attacked Donald Trump and said very nasty things about him during the presidential primary became some of his strongest allies. And so I think one of the big issues is how enduring will the legacy of Donald Trump and Trumpism be in terms of its hold on the Republican Party? I think prior to the 2020 election, the big question that Republicans faced was they knew that they couldn't win without Donald Trump's base, but they weren't sure that they could win with Donald Trump's base, in the sense that if they said the kind of things and pursued the kinds of policies that they needed to in order to motivate and mobilize that base, would it alienate other voters who would side with Democrats and hand them defeats in the House and Senate races? And I think the lesson that I take away from the 2020 election is the answer to that is yes, you can win with Donald Trump's base. Across the board, Republicans won in just about all the Senate races and they weren't even close. In terms of House races, Republicans won every House race that was deemed to be a toss-up by Cook Political Report and other organizations that rate congressional races. They won every single toss-up race, and even won a handful of races that were rated to be leaning in the Democrats' favor. Democrats did not pick up a single toss-up seat or a single seat that was leaning Republican. By any measure, that is a wave election in favor of Republicans. So the big question I think now that Republicans face, given that I think there's a very good chance that they will maintain the majority in the Senate, is do they continue to follow what Trump has presented for their party, or do they break from that and move back toward some of the more orthodox Republican Party positions like free trade? Do they change their position on immigration? Other issues regarding social issues and healthcare. But I don't think the signs are good that they will do that. Especially given the length of time it's taken for Republican leaders to acknowledge that Joe Biden is in fact the winner of the 2020 election. And so I think that the big question for Republicans is, can they put the toothpaste back in the tube, or maybe better analogy would be the self-tanner back in the tube. Now that Trump he won't be in power, right? He won't hold political office, but he still will hold sway over the party, given the kinds of coalition that he built to win the presidency, and that coalition continues to support Republicans at other levels. So, I'm trying to get out of the prediction game because I've been pretty off lately. But it seems like I don't anticipate that Republicans will steer back to where they were prior to Donald Trump. I think Donald Trump will continue to resonate throughout the Democratic Party, especially as he embarks on his campaign for the presidential election in 2024.
Thank you, Dr. Warrow. Dr. Mincy, can you share some thoughts? Oh, looks like we have you muted. Are we able to get you unmuted? There we go.
Are you able to hear me now?
Yes.
Okay, sorry, thank you. So sadly, my comments are very much echo those of the previous speaker, except he has more expertise in this area than I do. I think that one of the primary concerns that we all have to wrestle with here is the enduring influence of Donald Trump on the Republican Party, and the degree to which, beyond the direct representation, he will continue to hold sway over large swaths of the politically interested population, in terms of basically very fundamental threats to our democracy, and therefore the ways in which sort of progressive policies have room, because his influence will continue to operate. It will continue to operate both because of, again, his enduring effects on the House and on the Senate throughout the Biden administration. I concur that it's not clear that the two Democratic senators who are running in the runoff election in Georgia, the Democrats are going to prevail, and if they do not, I think we will see very much a presidential administration in the Biden administration in which President-elect Biden is able to achieve some key legislative victories in the early rounds, but unable to accomplish much of the legislative agenda in the following sort of 3 years of his administration. And I would remind our audience about despite the euphoria, worldwide euphoria around President Obama's election, after healthcare reform, President Obama was virtually unable to get much of his legislative agenda accomplished in the next 3 years. And so, in terms of the passage of legislation that will fund the distribution of the vaccine and accomplish some important things in terms of not a stimulus package, but a new care-like package in the early years of his administration. I think this next several years will be very difficult in terms of legislative victories, and we will continue to feel the influence of Donald Trump on many issues that many of us in the School of Social Work care about, and particularly those that have to do with racial injustice, the whole debate around which I was excited to see emerge over the summer. Sadly, after the death of George Floyd, I think I'm concerned that liberal Democrats mismanaged the debate around the reallocation of resources away from the police toward other sorts of professionals who are able to deal with communities and people in crisis. I think that they bungled it by labeling it defunding the police and scared a lot of people away from that agenda. And I am seriously doubt whether or not much progress is going to be made along that agenda in the latter years of the Biden administration. And I think the other thing that we have to look forward to is the next election cycle, in which we will have many competitors, both within I think we have important fractures, obviously, within the Republican Party, but there are also some very important fissures within the Democratic Party around issues about, how liberal can we go on policies having to do with police reform and education and taxes and the like. And I think those fissures are likely to sort of complicate the work that the incoming Biden administration will hope to accomplish.
Thank you, Dr. Mincy. I appreciate you making that connection between Biden's challenges and what Obama faced with pushing through healthcare, and then immediately getting a lot of pushback on other legislative initiatives. And I'm wondering, Dr. Dahl, if you can speak to what you see, particularly with respect to healthcare, and we know the threats that are happening to the ACA, but both from the Supreme Court and just from Republicans in general.
Much, Karma. Yeah, so from a health policy perspective, it's been really interesting to see how healthcare has remained at the top of voters' agenda for multiple election cycles now. And that's been for both Democrats and Republicans. We heard a lot about healthcare, Medicare for all versus the public option during the Democratic primaries. We also hear Trump talking about, high drug prices, protections for the people with pre-existing conditions, right? These are key issues that we're hearing about from both sides of the aisle. So far, the focus on healthcare has seemed to really benefit Democrats. And that was particularly true in 2016. And I think a lot of people think it's a big reason why they won the House that year, right? Is that they actually had some real solutions and were really, making noise about the potential for Republicans to take away protections for those with pre-existing conditions. So it seems to be a winning issue for Dems, at least pushing them that way. But, we know healthcare is an issue that virtually every person in every household feels is relevant to them. And that, whether you need healthcare for yourself or someone that you love. And it seems that Americans are growing more and more discontent with the status quo, right? There's much more widespread recognition that the system is unfair, a lot more knowledge about what makes the US different than other countries. Why can Canada have single payer healthcare while, the US continues to have such a fragmented system where so many people can't afford access to care? And, the COVID pandemic has only exacerbated these concerns. We see these really wide racial and income disparities and who's suffering most from the virus. And, we know that's shaped by structural racism, across society at large, but in particular, in the social determinants of health and in healthcare access. So, to your question about what we can expect to see from this administration, I think we'll see that public health and healthcare is at the top of the administration's agenda. And that'll be for the first year for sure, and maybe even longer. They're going to face this huge test. It's a scientific test, it's a logistics test, it's a communication to the public test and a public trust test to effectively deal with this pandemic, roll out the vaccine, make sure people get it, and get this country sort of rolling again. So there's just really no doubt that that's the #1 priority of the administration. And I do think we're going to see attempts to take actions around healthcare policy that's not COVID related. But, as both Greg and Ron have said, it's going to be really hard for there to be any legislative changes, really to go after those big policy items that were discussed in the Democratic primaries, or even in Biden's platform. I think without Democratic control of the Senate, we know things like the public option are dead on arrival. So, you know, that's the situation we're in. It's probably unlikely we're going to win both of those seats in Georgia. So that means there's going to be a lot of friction as Biden tries to make progress. And we can talk about it, you know, when we talk a little bit more about healthcare. What can they do without Congress? You know, what can Biden do without Congress to improve healthcare access? And there are a number of measures that can be taken, and I'd be happy to talk about what those would look like. But I think we need to temper our expectations, you know, in terms of these big policy items that I think got so many Democrats excited during the primaries, because it's just not going to be feasible in the current environment. There will be a lot of focus on defending what we have, right? Continuing to defend what we have, maintaining the ACA, trying to build around the edges. And I think that's, you know, what we can expect the administration to really be focused on for the next couple of years.
And Dr. Mincy, I'm curious, you talked about racial justice in your earlier comments, and what would you see are some of the top policy concerns, particularly around advancing racial equity, racial justice, not just for social workers, but anyone who's involved in that kind of work or that professional sphere?
Well, I think one of the most important issues around racial justice isn't very far away from the pandemic, because one of the things that we know is that both the health consequences and the economic consequences of the pandemic have been very unequally distributed in the U.S. And communities of color have borne the brunt of both the health consequences and the economic consequences. And so what I find interesting is that we can see a very deliberate recovery of the unemployment rate, for example, since the summer, so that we're now at an unemployment rate of about 6.7%, which means that we are just slightly below full employment in the United States. That said, in communities of color, the unemployment rate is substantially higher. I think we also know that both in African American and Latino communities, we've seen much higher rates of the incidence of COVID-19. We've seen the devastation of COVID-19, particularly on unemployment rates among women. And as a result, since so many African American women are the heads of families, or the single heads of household in African American families, it's had a devastating impact on the economies of African American families. I think the other thing that we haven't seen because of the way we collect or fail to collect data is that the mortality rates of COVID among African American men are higher than any other group in the country. And therefore, as we seek to tackle, I've been interestingly surprised at the articulation of how the vaccine is going to be distributed as it becomes available. And so we know that healthcare workers and people in a variety of institutions, particularly for veterans and the elderly, will be the first recipients of COVID vaccine. But then there's a discussion of distributing the vaccines to communities that have been hit hardest, and that will mean communities of color. So I think that's a good thing, but I just worry that the long-term consequences, and I also think about resource allocation. Sorry, I'm an economist. So I worry not only about the fact that Congress has yet to approve the resources that will be required to distribute the vaccines that are already available or coming online. And so we have, it looks like we may have, hopefully, a health solution to the problem, but without a strategy to fund getting it to the public, it's still going to remain a problem. I think the other thing that I think about in the resource allocation question that's related to, well, how are we going to get to the vaccine, is the reticence on the part of people of color, particularly African Americans and Black people generally, to take the vaccine, which means that in addition to the basic cost of getting it to people, we're going to have to spend additional resources to in the messaging so that more people of color are willing to take it when it is available. And so I think those are in the short term, just figuring out how to undo the unequal health consequences of COVID. If we are able to accomplish much of that, that will be par for the course. And then there are a whole vector of downstream issues around racial inequality that that we may not have an opportunity to get to after we address this one, particularly the issues that were that folks centered on mass incarceration, on the unequitable distribution of police protection. I think these are important issues. So I used to teach social welfare policy. I miss it because one of the things I used to teach in my class and think about the history of social welfare policy is that we have these big shifts around crises. Crises are usually about war and recession. So there may have been something looming on the public agenda, but with war and recession, the country sort of shifts gears, deals with those emergencies and comes back. And then with the return, it is not necessarily the case that the issues that were looming before the urgency are the issues that are looming thereafter. And I worry about that. So we got focused during the summer, and lots of people got focused on the unequal police protection that we've seen for decades. However, I wonder whether or not on the other side of Biden's inauguration and dealing with the healthcare crisis, whether that issue will be able to retain the amount of public attention, advocacy, et cetera, that it achieved prior to the inauguration.
Dr. Mincy, I mean, in addition to the racial disparities around healthcare and this public health crisis, we've also seen that with respect to voting rights, right, and disenfranchisement. And there was a lot of work obviously done in Georgia. We've talked a lot about, or we've heard a lot around Stacey Abrams' activism work there. And I'm wondering if any of you, or in particular Dr. Warrow, could comment on, how we see how this election has been handled or managed and the outcomes and the misinformation, how that could be impacting voter rights and voting access moving forward, particularly as we get to that January deadline in Georgia for the special election.
I think one of the hopes that was associated with an anticipated Democratic wave is that Democrats would get enough seats in the Senate that they could push through federal legislation that would address some of the things that are going on at the state level with regard to voter disenfranchisement. I don't think that will happen now. Even if Democrats do get the majority, I don't think they would have enough votes really to break through Republican opposition to do things like shore up the Voting Rights Act. One of the key things that has happened that has really changed the electoral landscape is the Holder decision, which gutted a key portion of the Voting Rights Act of 1965, which required pre-clearance of certain states before they could change their electoral laws. And so with that, we've seen at the state level many steps taken to disenfranchise voters, to make it harder to vote, and that impact, I think it's the case that it has the potential to adversely impact certain groups in particular, right? African American voters. It's the reason those pre-clearance measures were put in the Voting Rights Act in the first place is because those places had a long history of some of the worst practices when it came to disenfranchising African Americans. So I imagine that there will be legislation that is introduced, and it very well may pass the House that will try to restore certain features of the Voting Rights Act. Whether it can pass the Senate is another question, even if the Democrats do control 50 seats, and with Vice President Kamala Harris being able to break the vote. You have the filibuster in the Senate. I don't think the filibuster is going away anytime soon because you would need all Democrats to support that, and there are certain individuals who have indicated they're not in the Democratic caucus who are not going to support that. So I think one of the heartening things though about the 2020 election and the 2018 election was the pushback against these measures, and that as we saw more steps taken to make it harder for certain groups to vote, that those groups worked even harder to get people registered, to get them to the polls, and that seems to be I think the data is still out on this, but that seems to be the story in Georgia, right? Just the fact that Georgia was able to become Democrat, not only just be close, but the fact that Biden could win in Georgia, and that the Democrats do have a legitimate shot of picking up those Senate seats. I just think that's that the voter mobilization efforts behind that in Georgia, people outside of Georgia who are working in other states as well. I think that's very encouraging. And even with the hurdles that are being put up, the fact that individuals are working so hard to counteract that, and that individuals are exercising the right to vote. We had tremendous turnout in this election. Turnout has really we've seen a resurgence in turnout. We're getting to levels that we haven't seen in many, many decades. And that's very encouraging. It's happening on both sides, right? Both Democrats and Republicans. But greater turnout can only be a good thing for democracy, in my view.
Carmen, may I ask a question?
Sure, absolutely.
So, Dr. Warrow, I'm very interested in your response to the following. So we've begun to talk about a topic about racial inequality, and I like to think about that topic in terms of its meaning to the broad body politic. So I think particularly in the last several years, with the discussion about voter suppression, with the George Floyd incident and the like, you have lots of Americans who have become much more aware of and more conversant with and more sympathetic toward the issue of racial inequality. However, you also have Americans who really do believe in a government that has three offices. It has a legislative branch, an executive branch, and a judicial branch. And what, Dr. Warrow, do you think that part of this idea about creating balance across those three jurisdictions, and particularly to make sure that you can give the executive branch to a Democrat, but you want to make sure that there is you don't sort of overbalance the system by also giving Democrats control of the House and Senate, because if you do, the kinds of legislation that will result will be so lopsided that will be difficult to bring it back to something central that we all can live with. Do you think that is part of the reason why this election was such a mixed bag? A clear victory for the Democrats in the executive branch, but a weakening actually of what the complexion would be in the legislative branch.
Yeah, I think there's actually a lot of evidence to support this kind of balancing theory, and it actually goes back to the early -- some research on this, both theoretical and empirical. So I do think there is something to that. One of the things that is very interesting is there's a measure, an aggregate measure called I refer to as policy mood. People aren't necessarily comfortable with it, but it's an aggregate measure taken from a battery of survey items that indicates which direction the American public wants policy to go, in a more liberal direction or a more conservative direction. Mm-hmm. And so if you look at this measure, which exists for most of the post-World War II period, it fluctuates, it goes up and down. It's almost cyclical. And when you look at how this measure plays out, if you plot that measure against partisan control of the federal government, there are two things that you see. The first is that when people want policy to go in a more conservative direction, they elect Republicans, right? When they want it to go in a more liberal direction, they elect Democrats. And so that suggests that there is responsiveness in our system, which a lot of people think that our system is not terribly responsive to the American public. But that's a measure that I take away, that there is responsiveness. But the other thing that you see is that as soon as you elect Republicans after wanting policy to move in a more conservative direction, it flips, it goes in the more liberal direction, right? And so you never see this series ever just follow a straight line, right? It's always going up or down. Sometimes it's going up a lot, sometimes it's going down a lot, sometimes just a little. And it does seem to respond like when we have periods of divided government, right? So for example, when Bill Clinton was elected president in the 1992 election, the mood was going up in the liberal direction, right?
Mhm.
Clinton gets elected, it starts to go down in the conservative direction. Then Republicans take over both the House and the Senate after the 1994 elections, and guess what? It starts to go in the more liberal direction. So, I'm not quite sure what to make of this, but one interpretation is the American public is never really happy.
Mhm.
But another interpretation could be that they just seek balance, right? And that there is very compelling evidence that the Democrats and Republicans are as polarized now as they've ever been in American history, at least in terms of, as far back as we have reliable measures of the two-party system that currently exists. But so the fact that you have two extreme parties who are battling out, and they have their competing bases, which are much more liberal, much more conservative than your typical voter, that the only option for more moderate voters is to do this kind of balancing. Now, this is an incredible coordination problem, right? The fact that we don't have national elections in this country. What we really have are a set of local elections, either at the state or congressional district level, if we're talking about federal elections. So to be able to coordinate this is an incredibly complicated problem. But the American electorate seems to have figured it out to some extent. This is not to say that they're happy, right? If you look at approval ratings for our federal institutions, they're not great, right? And so I'm not quite sure how we get out of this, right? Maybe perhaps if polarization decreases, polarization between the parties decreases, then the electorate would be more happy, and we wouldn't have these kind of wild swings in control, right? So Barack Obama wins 2008 after Democrats sweep in 2006. He gets this massive majority. He gets a nominal supermajority in the United States Senate, which we hardly ever see. But then 2 years later, control swings back of the House of Representatives, a landslide election in favor of Republicans, where they pick up over 60 seats. An historic win for Republicans. So only 2 years removed from this victory, which I view as largely a negative response to what happened during the George W. Bush administration. Republicans are brought back into power in the House in a big way. Right? So,
but I think the implication for all of this, for those of our students who are interested in policy, is because of these ebbs and flows, it may take an entire career to move the ball around any issue with which you're concerned. And so Jamie, I would suggest that our long-term effort to get at something that feels like national health care is a consequence of that. That you can care about something, and you can understand, and you can be after something, but the ebbs and flows in the context of the politics that we're working with means that anybody who's interested in an issue has to be interested in it for the long haul. Otherwise you'll never see the result that you're after, or the ball won't appear to move, because you have to stay at it through these ebbs and flows that are part of the context. Jimmy, would you agree with respect to the history of our efforts since Truman to get healthcare reform?
Yeah, I think that's absolutely right. It's been a long battle. I think there are people who have been at this for a really long time, trying to establish some form of universal coverage in this country. And I think, the Affordable Care Act and what Obama did was so monumental, right? And sometimes we don't recognize what a fundamental shift in health policy that was, and what a landmark legislation it was. But there's just so much more that Americans want. And I think what's so interesting with healthcare now, and why I think it is continuing to be seen as so important, is that now, the middle class are really affected by healthcare costs. It used to be, if you had an employer-sponsored plan, you were doing pretty good, right? And there was then a lot of resistance when others were talking about maybe moving towards a public model, right, or a single payer model. So much concern even during the time of the ACA's passage about what did that mean for people with employer-sponsored coverage? Who's going to lose their coverage? Now people, like professors like me, I have a great job and I still have a high deductible plan, right? I just had a baby this year and I spent thousands of dollars out of pocket. And so when people with good jobs are facing these types of costs, right, and it comes into middle-class households, I think the conversation really is shifting. And that is going, I hope, or at least I think it might be a little bit more persistent, because it's something people are dealing with, every month, every year, looking at their annual healthcare costs. And people are not so happy with their employer-sponsored coverage, right? So the Republicans used to have a really strong argument, when they started to talk about what was going to be taken away. We all know people hate for anything to be taken away from them. And now if you're saying, okay, you're going to take away my high deductible plan, well, maybe I'm okay with that. Maybe that's all right. And so, that really changes things when that core, middle class, to the extent that we have a middle class anymore in this country, it feels those effects. Like I think it'll keep it at the top of the agenda, for at least, the time being. Yeah.
What changes, if any, do you see happening around healthcare, Jamie?
So, like we talked about, right, with the Senate being controlled by Republicans, we're not going to see any big legislative changes. But I think there are a number of regulatory changes that could be taken that could improve, healthcare access and health insurance access. Unfortunately, a lot of this work, though, is just reversing what Trump has already done, right? So that's unfortunate. We'd be hoping we could be putting forward more positive proposals. A lot of that's going to require money, so it requires Congress, right? But there's a lot that the Trump administration did to erode healthcare access and health insurance in this country. So some of the things that we're probably going to see the Biden administration immediately reverse are things like restoring funding for health insurance navigators, expanding the open enrollment periods for the health insurance exchanges, changing the priority for state Medicaid waivers. So those are waivers that states put forward to make changes to their Medicaid program, to be clear that those should be for expanding coverage, expanding access, instead of hindering access, which is what it was under the Trump administration. So for example, the Trump administration favored work requirements, which would require Medicaid beneficiaries to prove that they were looking for work or were employed to maintain their coverage in Medicaid. Those types of Medicaid waivers are not going to be favored under the Biden administration. That's a change that can happen immediately. And generally promoting these state level policies that expand access can make a real difference for, the Medicaid program across the country. So we're going to see a lot of these types of things. Or, another example, Trump gave employers a little bit more wiggle room to try to opt out of the contraceptive mandate, which required them to provide contraceptives with no out-of-pocket costs to their employees. Biden administration can immediately change that. So there's a lot that can be done. But like I said before, it's sort of keeping us in the status quo, getting us back to where we were before Trump, a little more than it is about, sweeping new changes to healthcare. But it doesn't mean that these aren't going to make a difference immediately in the lives of people.
But Karma, I think the part of it that, as I'm thinking about our students as part of our audience, that a lot of the changes that Jamie just spoke about in terms of healthcare reform will be accomplished by executive order, not by legislation. And this refers to the beginning of our conversation. And that is to say, one of the Achilles heel of the Obama administration is that after Obamacare got passed, much of things that got done in healthcare, as well as in many other areas, were done by executive order. And I think the president-elect has already signaled a sensitivity toward that he does not feel, in part because of that experience, that using executive order to make major advances in many sorts of policy is a very short-term solution. And that means it sends two signals. One, the policies, they're going to have to be real priorities around the policy areas where we will make progress through executive orders, and there are many other areas where progress is needed, where executive orders won't be in place. And the other thing about people in our audience who are interested in being part of the policy-making process, this is what you have to live with, that you will have big opportunities in legislation, and that depends upon the political context, and that political context is going to shift throughout your career. And secondly, you got to be in it for the long game, because otherwise, because the climate in which you're trying to make policy change is going to change because of a lot of variables that are part of the mix. And that's the fun and frustration of being a policy law.
So do you think we'll see something similar happening with immigration policy, for example, speaking of executive orders and changes and shifts?
Right, and we're seeing it already. And I think, for example, DACA will be an area in which we will, the president-elect will use executive orders to turn that radically. But I wonder whether or not executive orders will be brought to bear on the issues around police violence, et cetera. And so some of us will have to wait, and others of us will see the issues that we care about move forward, not necessarily through legislative process, but through executive orders. And then who knows what's going to happen because the Supreme Court composition got radically changed. That's a whole nother dimension. But I'll let you're the moderator, sorry.
Greg, it's a conversation. I'm just here to sort of help move it along. But yeah, jump in at any time. Greg, I thought I saw you sort of leaning in a little bit. Did you want to add?
No, I think those comments are spot on. The role of executive orders and the balance and in the separation of power system between Congress and the president, it's been challenged over the past 20 years. I mean, we George W. Bush using signing statements and those kinds of things. Had the Bush-Cheney administration's broad view of executive supremacy. I think Obama didn't want to do a lot of what he did via executive order, but after the Democrats lost the House in the 2010 elections, what else are you going to do? Especially when you have a party that is basically not going to cooperate. Mitch McConnell said that his #1 goal was to make sure that Barack Obama was a one-term president. It's curious. I don't know what they will be able to accomplish legislatively. I think they will try. It's a different story if Mitch McConnell is majority leader versus Charles Schumer as majority leader. I do think that there is some room for a modicum of bipartisanship with Susan Collins, Lisa Murkowski, and there may be a few others that Pat Toomey even. He's a very conservative senator, but he's basically retiring. But he clearly he was one of the first ones to come out and say that Donald Trump needs to we need to move on from Donald Trump. It's not to say that that if you take Trump out of the Republican Party or reduce his influence, that you're going to be on easy street. There's still pre-Trump there was an awful lot of opposition to what the Democrats are trying to do in the Republican Party. So I think that I have a relatively pessimistic view on this. I think that that there is a desire to move away from making policy through executive orders, but I think just like Donald Trump discovered after the Republicans lost the House in the 2018 midterms, that really, you can say, I don't want to do it this way, but it's really your only, it's in many ways, that's really your only option. I do think that, there are some things, the filibuster is a big issue in the Senate. I don't think it's going away, but you can use the reconciliation process in the Senate, right? That's how Obamacare eventually passed, was through reconciliation procedures, which make the filibuster a non-issue. I think, if there is reform, if you can take steps legislatively to shore up Obamacare, that can be done through reconciliation. Maybe some climate change, but other areas where you might want legislative solutions like immigration, you're just not, reconciliation is supposed to be very narrowly tailored to specific types of legislation. And while that's been pushed in ways that go well beyond, I think, what the original legislative intent was for that kind of protection, I do think that that there is a very limited band of things that you can try to accomplish legislatively. I think they'll try to do that. They'll see. My guess is they'll probably fail, and then we'll just see executive orders that will be controversial, but may bring about real policy change that get us back to, like Jamie was saying, back to sort of pre-Trump positions.
Your mention of climate change makes me think of this unique position with John Kerry that Biden's created in his cabinet overall. I'm wondering what your thoughts are for all of you on Biden's cabinet, especially as they're starting to include a lot of folks who worked on the Obama administration, even though Biden has said over and over, this is not a third Obama administration. So, what do his proposed selections for his cabinet say about his plans for leadership?
Well, so when we think about at least economic policy, I think even the current leadership of the Federal Reserve has had to be very expansionist. So interest rates will be low throughout in order to facilitate economic recovery. And there's nothing that the Biden administration can do in the short term to affect the Federal Reserve. However, in terms of the Treasury Secretary, Janet Yellen is a very expansionist pro government spending type of economist who led the Federal Reserve in the early part of in the Obama administration. And then his other choices for the Council of Economic Advisors in Celia Rouse and in our own alumnus, Jared Bernstein, are very much government interventionist types of spenders who have real concerns about the poor. Celia Rouse is a labor economist, and Jared Bernstein is obviously concerned about any issues of inequality. So I think that these are very good choices that will portend a very activist role of the federal government in facilitating economic recovery, and facilitating economic recovery in a way that tries to make sure that recovery touches more of the poor and the disadvantaged. And from that vantage point, I think his team is a very good one. But I also worry about the implications of that sort of administration for the next political cycle, because I think one of the looming issues in terms of the economy that it's very clear will have to take a backseat is the debt. We are now, there are forecasts that the GDP to debt ratio will not fall below 120 through 2021. And nothing that we can, this is, there's an open wound in the society as a consequence of both the economy and our healthcare needs, which will require additional deficit spending for the foreseeable future. That means that we're going to wake up 4 years from now in a new presidential election, and the arguments that the Democrats have allowed the debt to go wild will be an issue that Kamala Harris will have to deal with in her bid to become the next president of the United States. And so these are going to be very treacherous times in which it seems to me there's no choice about what we have to do in the short term. And President Biden has created a team that will be fully on board with getting those things accomplished. But I think the long-term implications of all of that for the debt and again, the long-term the swing, the back and forth that Greg and I were talking about are sort of embedded in that same formula. But I'd like to know what others think.
I mean, add just a few notes on some of the, cabinet picks. I think in healthcare and in response to also the COVID situation, I think a lot of people are really excited that Biden seems to be favoring experts and scientists and bringing their voices to the forefront. We are going to have Rochelle Walensky, who's the chief of infectious disease at MGH, taking a big role. Vivek Murthy is back, the former Surgeon General under Obama. Fauci's going to be the chief coronavirus advisor. Seeing some of these, really well-respected experts given platforms is really exciting to people who feel that science has been neglected for the last 4 years. And is a change from, if you look at some of the names that are on the current COVID task force, led by Mike Pence, it'll be a real shift. So that's, I think, really exciting for a lot of folks. A lot of these people are also, folks that Biden, has relationships with before. And it seems like that is something that he's interested in doing, is working with people that he's worked with before. There's a lot of familiar names and faces, and hopefully that'll mean a lot of cooperation and positive outcomes. But instead of what seems to at least been a very combative and competitive sort of environment that's been existing in the executive branch under Trump. One thing about so for HHS, Health and Human Services, the pick is Javier Becerra. I think this is very surprising to a lot of people, actually, against what I just said about picking medical experts and scientific experts. He isn't a medical expert, right? He's the current Attorney General of California. And so it's been a bit of a surprise. I think, he has more of a profile in, criminal justice and immigration. But I think one of the reasons that he was chosen is because, there's a lot of concern about legal efforts on the healthcare front. And I think he's expected to be able to handle those challenges well. He has been very vocal, for example, in fighting for women's health. He led a coalition of state attorneys general to challenge a Mississippi law prohibiting abortion past 15 weeks. So he has this reputation, as a fighter for healthcare from a legal perspective. And I think that sort of gives you a sense of like where the Biden administration thinks the challenges and action are going to be in healthcare, and that some of this is going to be more in the judicial branch and dealing with, new state policies that may be trying to limit access to healthcare, access to abortion, issues like that.
I would just add that I'm curious to see how things change with this set of people, given what we just went through with the past 4 years. I think it's fair to say that the members of Trump's cabinet as top people were not from the A-list. I think that a lot of people who might have served probably took a pass because they did not want to be associated with Trump and Trumpism. I do think that the people that Biden is selecting are, they are the very top people in their fields. And so is that going to make a difference, right? I think a lot of people thought there was tremendous incompetence over the past 4 years that led us to have some very bad outcomes, especially with the pandemic. There was just an article this morning about the CDC, about the gutting of the CDC. And now that we will have people back at the CDC, I think that is, this is the worst. You can't imagine a worse time for this to have happened to the CDC. Even prior to the pandemic, this was happening, right? And if the CDC, as the gold standard when it comes to health agencies, had been maintained as it had throughout most of its history, would we be seeing very different results now for the pandemic? So this is the test. We're going to see that now. The CDC will be restored. These other agencies will have, in my view, very competent, very politically savvy people who do not have, some of them have baggage, but not like a lot of what the Trump appointees had. Not to sound overly negative about the Trump administration, but I think this will go a long way to restoring some of the concerns that people have about government. There's a lot of mistrust of government now. You see it in the polls. You see it breaking down along partisan lines very starkly. But I'm curious to see whether this will restore some faith in our institutions and their ability to handle the deep problems that our country's facing.
So speaking of that, and speaking of sort of will this make a difference, one of our questions from the audience is, with Trump now out of the presidency officially, do you think that any of the handful of moderate Republicans in the Senate will be more likely to vote for more progressive legislation than the Democrats?
It's a very good question. It goes back to my opening comments about what's the legacy of the Trump of Trump and Trumpism. Trump took it to a different level when it came to slash and burn tactics for people who opposed him, and so he's gone around promising primaries, overtly threatening primaries for Republicans who opposed him, and I think that's a large degree that kept Republicans in check who wanted to oppose him. And so can Republicans break out of that cycle? And it's you know, the evidence is mixed about the extent to which primaries have exacerbated partisan polarization. But you know, when you have the leader of the political party who is raising you know, hundreds of millions of dollars threatening individuals who oppose him, you know, are we going to be able to break out of that cycle? And you know, I think that's the number one question when it comes to. I do think there is possible to pick off like Susan Collins. You know, she's not up for re-election again for another 6 years. Who knows if she will run for re-election again? You know, there may be some others who will want to moderate. But you know, there are individuals in the Republican Party who are looking to take up the mantle of Trumpism and continue to push it. Ron Johnson in Wisconsin, for example. Mike Lee in Utah. There are others who, you know, whether Donald Trump's going to run in 2024 or not, I still think there are individuals in the Republican Party who will continue to embrace Trump's tactics and his positions. And then, you know, this is the, you know, struggle I think that Dr. Mincy mentioned within the Republicans, and we'll have to see who wins out.
So another question from our audience, and this sort of relates to some of your comments earlier, Dr. Mincy. As a systemic issue, racism should be addressed in any sector, but which ones in particular, economics, public health, education, may be the most effective catalyst for sustained change? And how might this new administration address racism differently compared to previous administrations that faced similar major civil rights issues?
Wow, that's a really tough question. You know, so I will give you the answer that comes to mind, and that is that part of me believes that the most important place to deal with systemic racism is in education, and both from early childhood education and access to early childhood education and what is occurring in elementary school. So you look at what's happening in communities of color right now as a consequence of the inability of many low-income families who are disproportionately families of color to be able to subsidize what is publicly available in terms of their children's education. And so they are being whipsawed between when school is open and when it is not. Parents don't have lots of opportunity. Well, the fits and starts of negotiating how to educate my child in an environment in which school is on and school is off are just unimaginable. And particularly if you don't have the resources to subsidize what's going on, to get an educator, to get tutors, to get other kinds of online equipment so that your child isn't restricted to only the information that's available through the public education system. And depending upon where you live, that availability could be excellent or far less. And so, but because early childhood education has such an impact on the outcomes of people as they move through the life cycle, it's very, very important to try to get it right and more right when people are younger than when they're older. That said, if the likelihood that I'm going to be harassed by a police officer is, in other words, if at the other end of the age spectrum, one's educational attainment doesn't protect one from the abuses of the police, then that makes me want to concentrate on that end of the spectrum. And so I worry that I still believe that, and again, the middle of the distribution is important as well. So one of the things that we are seeing, which we should applaud, is the decline in the gap in high school graduation rates by race and ethnicity. So that gap is closing and closing rapidly. And the rates at which African Americans and Latinos are enrolling in college is increasing. What is not increasing on the third hand is the rate at which people of color are graduating from college, whether we're talking about a 2-year degree or a 4-year degree. And in addition to that, this problem is magnified when we think about men of color. the rate at which men of color are graduating with a 4-year college degree is they get in the system, they circle around, many of them don't complete, they have a multiplex of responsibilities that means that it is difficult for them to sustain their commitment to higher education and complete. And that has a huge implications for their earnings later on, because even prior to the pandemic, what we saw was a real parting of the earnings distribution between people who have a 4-year degree and people who do not. And this, as I mentioned, one of the huge consequences of this pandemic is that people without a college degree, you know, we have a wonderful conversation going on in the School of Social Work about privilege. And we talk about privilege all the time. What I point out to my students is that we are privileged because our work has been interrupted in a very minor way by the pandemic. So now I'm not in the classroom, I'm online all the time. But other than that, things are smooth and sailing. However, there are lots of people who have difficulty getting safe transportation to work. They're much more exposed to the virus as a consequence of having been out in the public delivering groceries and all the stuff that we're dependent upon online. If you're working in a small business, the collapse that is occurring in the small business sector, which is a major sector for growth and employment, is hurting a lot of low-skilled people as well. And so I think dealing with racial inequalities, I would still emphasize, you know, I had a mentor who said, Mincy, make a choice. I would start dealing with the racial inequity issues in early childhood education and in the elementary school grades. But we do have some real issues to accomplish for people who are adults and who are trying to get into college and get a 4-year degree, as well as the whole issue of mass incarceration and you know, I ended my class this year talking about externalities. Externalities are goods and services that we buy that have an impact not only on the purchaser, but on other people. It seems to me that the fact that I pay taxes for police protection, but the police protection I get is very different than the police protection of half of our panel, is a real problem. And so I hope that we're able somehow to stay on this issue of police violence, so that more of those young children who end up getting an education and having a good career don't have to fear being locked up or brutalized for some mistake that some police officer made because they felt threatened.
Thanks, Dr. Mincy. And Jamie, I wonder if you have any thoughts on how we can address the racial disparities that we're seeing on the public health side, particularly as we're going to be battling our current public health crisis for quite some time, it seems.
Yeah, I mean, I think one of, you know, we've sort of talked about this, and there's a massive need, right, for there to be a relief package passed as soon as possible. We know the communities of color are suffering the most from this virus, and, you know, we cannot expect people to take public health measures if we're not giving them, you know, support that they need, right, to survive in this, and you know, if we're asking people to lock down, we need to be providing some economic support to make that possible. And so I think that's just like day one. I mean, hopefully this happens in the next week or in the next few days, but that just seems like such a priority right now to get that relief package out. I mean, it's so absurd that we're in a situation where that money is not flowing to the communities that need it. In healthcare, though, I mean, I think I really agree with Ron about the importance of education in terms of addressing racial disparities in this country. I am always humbled, though, you know, in thinking about in healthcare, you know, this fact, for example, let's think about maternal mortality. If we look at, you know, women, even high income Black women, we know are much more likely to die from childbirth than high income white women. And when we see that it's not just about, you know, income, it's not just about whether you have private insurance or you have Medicaid or what doctors, you know, you see if you have access to specialists, that just the fact of being Black, you know, puts you at higher risk of dying from childbirth. And we haven't figured out how to deal with that. You know, how to deal with that issue. You know, there's a lot of focus on, you know, implicit bias training for healthcare providers. We don't know if that really works. Do those trainings really address that issue? We don't know. And I think there's a lot of suggestion that that isn't going to be enough. And those are, you know, huge problems in healthcare that need to be addressed. And one of the key issues relates back to education and increasing representation of people of color in the medical profession. So, you know, that Black women can take care of Black women. And we know that that's associated with better outcomes, you know, and just making sure that our healthcare workforce and, you know, and not just like nurses and other healthcare workers, but physicians, the leaders of hospitals, the leaders of our healthcare systems look like the communities that they serve and the people that, you know, rely on the healthcare system the most. So I just think there are these immense thorny issues that require such huge structural changes that, you know, we have to start from the very beginning, right from education, but, you know, we can't wait. We also can't wait, right, for these generations to move through this system. And I hope that we can find some solutions that will help to ameliorate some of these issues more in the short term as well.
Thanks, Jamie. Another question from the audience, and it's actually from one of our alums, Dr. Charles Lewis. Because of its ability to rebound more quickly from the pandemic, China continues to gain ground on the United States despite the many roadblocks from the Trump administration. Any chance the US will realize the need to invest in our abilities, particularly in human capital?
Well, I think one of the discouraging sort of phenomena that occurs early in the Trump administration is the sense in which many legislators at the state level and also members of Congress on the Republican side began to resist investing in public education, in higher education, particularly publicly funded, you know, state colleges and the like. Is that the idea is that educational attainment intends to make people liberal, and therefore legislators are reluctant to fund higher education because it has a direct political consequence, and that makes me think, Charles, that you know, the United States, one of our faculty, Irv Garfinkel, has this very important book and a huge chapter in the book that talks about the United States losing its leadership role because over time we have declined it to invest in higher education at the rate at which we did directly after World War II. And so I think this is a real challenge, and a challenge that we are experiencing now because there are real regional variations in the degree to which we have generous public funding for higher education. And I think it has an implication, and we are feeling it within our own school. So Jamie just, you know, ended on the point of we need to have more people of color at leadership positions in the healthcare sector and in other sectors as well. But often the children who will be able to go into that come into higher education with a lot of baggage, with a lot of, you know, it is typical that students of color who come into higher education have had a college, earned their college degree at a community college where they may have had multiple choice questions on their final exams for their entire undergraduate career. And then they come into graduate school and they're expected to know how to write, and they're expected to have math skills and the like, and to be able to compete on equal grounds with students who have been much more prepared for higher education than others. So I think this whole idea of equity in higher education is a big topic, and figuring out how to accomplish equity by not only making sure that students of color get a leg up from, you know, from the time they are born until the time they enter elementary school, but how do we really accomplish educational equity in higher education by not only admitting students of color and students who have come from low-income background, but delivering them the resources they need to be successful once they're admitted. And this is a huge agenda throughout higher education, and it's a huge agenda within our school as well. And it's not clear to me that by taking account of unequal preparation prior to going to college or prior to going to graduate school by holding students of color to a lower standard is the right way to get that done. If they're going to end up being a leader of a hospital, then they have to be excellent. And the question is, we haven't figured out, in my mind, how to accomplish that, how to take account of the fact that some students are better prepared for higher education than others, and hold them to standards of excellence and figure out what kinds of resources are needed to help them get there. I think it's a huge challenge, and one that we face in our school as well.
Thanks, Dr. Mincy. So our next question is sort of related to the earlier conversation around Biden's cabinet picks, and I'll leave this open to anyone to respond to. Do you think there'll be a lot of opposition in the Senate to his cabinet picks or particular selections?
I think so. I think it's almost become like a game where the new administration comes in and you try to pick off one or two of the nominees and send their nomination down to defeat. Who that will be, I'm not sure. Especially if Republicans control the Senate, then I doubt that every single one of Biden's nominees get through. If Democrats end up controlling, I think probably most of them get through. You might see one or two get picked off because of a scandal or something like that. I think it seems like we've gotten much better about vetting candidates to make sure that there's not a nanny problem or some of the other things that have tripped up candidates, nominees before. But there does seem to be, it's part of the blood sport inside the Beltway, where it's unfortunate, but competent people who would do a great job, they just get targeted and their nominations don't go through. But it's really, I'm, as a Congress scholar, I really want to see how, if Mitch McConnell continues to be majority leader, how he's going to play this, right? What if a Supreme Court seat becomes open? Will McConnell try to keep that seat open for the next 3 years, 4 years? I don't put anything past Mitch McConnell, and he's I have to say, for he's off. I can't think of a time where Mitch McConnell has made a political mistake that has cost his party. Amy Coney Barrett. Oh my God! Like, how could the party flip flop like this? They wouldn't even hold hearings on Merrick Garland. And then, Ruth Bader Ginsburg passes away. We have only a few weeks before the election, and the Republicans then ram through this nominee. How could he not pay, and how could his party not pay for this hypocrisy? Well, they didn't. And so, I think now that McConnell has acknowledged that Biden is the president-elect, there seems to be some movement now on another relief package. And so, is that a sign of things to come? McConnell's very good at reading his caucus and reading his the support that's out there for his party in the electorate. If you do get Susan Collins, and so suppose you get somebody takes up the role of John McCain, right? As kind of even the maverick role. Even though he was still one of the most conservative members of his party, he broke with him on important issues like healthcare. Is there somebody in the Senate who would currently play that role? Maybe Mitt Romney, right? Maybe somebody who is going to look to try to steer the party away from Trumpism and get the nomination in 2024. If you have a gang of 4 Republican senators, say, right, who do that, that really limits what McConnell can do as majority leader or even as minority leader. Mm-hmm. And so, it's hard to say, given that we've had this long secular trend of increasing polarization, and McConnell has been a key player in the way that the dynamics of the Senate have worked, where there's not much, there's a much reduced comedy in the Senate, which has largely been a body that welcomes bipartisanship, and because of the way it's structured, has to be more bipartisan. Given that McConnell now has, the media is saying like this is a major break with Trump, I'm not sure that's the case, but if it is, then this signals that there may be room for compromise on in a few small areas. So and I think a lot of these nominees will get through, but there'll probably be one who has to be sacrificed, unfortunately, just to keep the Republicans happy that they aren't rolling over to the Biden administration.
And I think something that Jamie said earlier in the conversation makes me wonder. I think healthcare is one of the few policy areas where the potential for agreement across, let's forget legislators for the moment and just think about voters. It was a little strange in March and April that the rest of the country seemed to be able to ignore and watch almost like spectators as New York went through a very bad time in terms of the coronavirus. But afterwards, we've seen that COVID-19 is sort of an equal opportunity threat that spread across the country and that hit rural areas in the United States in ways that were entirely unexpected, both because the virus was spreading, people were traveling, and because of the basically lack of hospital capacity in many smaller metropolitan areas throughout the United States. And therefore, I think Jamie is right that the coronavirus it sort of makes healthcare reform more of an equal opportunity issue. But other than that, it's difficult to see policy issues that tend to bring people together across the political divide. And so it seems to me that portends for, it's yet another reason why a signature issue during the upcoming Biden administration and in the Congress will be getting healthcare reform, getting the vaccine distributed, taking care of the COVID-19, trying to get rid of the pandemic so it's something in our history, and then to make further progress on healthcare reform so that we can sort of move a national agenda items forward. But after that, we tend to then have left behind a plethora of important policy issues on which the old divisions can tend to surface. And I wonder sort of what that means for the future of our country, really, and our ability to work together on a whole plethora of policy issues that are really, really important. I don't know. And not only that, but dealing with the healthcare crisis is really expensive. I think the other thing that I would remind our audience was, again, at the beginning of the Obama administration, one of the critical challenges were we were coming out of a recession, and we knew that we had to spend a lot of money in terms of the stimulus package to help the economy recover. At the same time, we were contemplating a multi-billion-dollar healthcare reform system. We are revisiting the same sorts of issues now, except that in the first few months of his administration, it looks like the Biden administration won't have the votes in Congress and in the Senate to accomplish a lot of things. So are we going to revisit another political cycle in which we take care of the healthcare system and then a whole range of other things are accomplished through executive order or not at all? And if we, in my view, as an economist, and thinking about, I think every student, the other audience, I think every student should read Hillbilly Elegy. It's the most important book I've read in the last 20 years, because what it speaks to is the degree to which working class Americans, and especially white working class Americans, felt disaffected by the Rainbow Coalition and couldn't buy into it. And as a consequence, it was one of the factors in the United States that created an opportunity for Donald Trump in 2016. And so on the other 4 years or 8 years after all of that, are we going to be in a position really to tackle issues beyond healthcare reform where there is a genuine common interest. One of those issues might be the threats to democracy that we experience that most of us have never seen in our lifetimes, where the idea that we would not accept a political election where the will of the public was respected, that we would actually challenge that for a couple of months. That's an issue around which we might find broad public consensus, but other than healthcare reform and the threats of democracy, I'm not seeing where those common ground issues really are.
Thanks, Ron. And
You
you
have to
said
end it on some other more positive note. So, please.
the most positive thing I can say is that exactly where you're leading us, this like, where do we go from here and what are our avenues for change and how can we do so from a legislative perspective or a judicial perspective is part of our conversation for the final part of our series, part 3 in January. So everyone will have to tune in to see how we respond to your last comment, Ron, around our next steps as a nation and possible avenues for change. And I know we're at time, so I want to first thank our panelists. Thank you very much for all of your thoughts, perspectives, your wisdom today. And I'm going to ask our Dean BEGG, to come on to close this out.
Just phenomenal. We're so grateful to our superb moderator and panelists for today's timely and thought-provoking discussion. The more informed we all are on these critical issues, the better, and we appreciate all of you for helping us get there. The obstacles may seem enormous, but so is our will. Thanks, everybody.
Thank you.
Greg, Jamie, it was a pleasure meeting you.
Yeah, you
Great
too.
conversation.
Okay.
Very glad to be a part of it.
Carmen,
Yeah,
thank you so much.
thank you all. Oh, thank you all.
Bye-bye.
Bye, everyone.